Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic and medical related information. I'm Dr. Adam Rodnick out of Commerce Township. We're here with our co-host, Dr. Ruben Rubenstein out of Troy, Michigan. Doing great. And our two special returning guests today, we have Dr. Lyn Peyton, neuropsychologist.
Glad to be here.
And we have Dr. Al Baer, who's a case manager and a psychiatrist.
It's a pleasure to be back.
Welcome back. So we were talking a lot last time you guys were on the show about traumatic brain injury. I'd like to talk about the three aspects of traumatic brain injury. If we could kind of enlighten our audience what three aspects are, not just one all-encompassing thing with TBI.
I call it the triad, the three aspects of traumatic brain injury. There's the physical components, things like headaches, visual disturbances, intolerance to light, ringing in your ears, things like that, some of the physical manifestations, and there's the cognitive aspects, memory problems, difficulty processing information, reading things and not remembering them, that sort of thing, having intellectual or cognitive issues, and then the behavioral issues, which can include being depressed, being anxious, having sleep difficulties, and being impulsive, doing things that are out of character. And those things all interact, and they also can not only affect the person's general health and well-being, but also can affect other injuries. A lot of times when you've had a head injury, you also have orthopedic or spinal injuries. So if you're depressed, you're less likely to respond to treatment of your spinal injury, for example. So these things, it's like a slippery slope. If you're not addressing all these issues at the same time, none of them are really going to get better. It's a very complex issue.
And it's really connected too, right? All three of them are really connected. If someone's in a lot more pain, they're obviously going to be more likely to be depressed. If they're depressed, they're more likely not to respond as well to the treatment of their pain.
Right, and there's the connectedness between the physical and the emotional and the cognitive. You can be having trouble with your memory, which then causes you to become more easily frustrated, which then causes more problems with the memory, which then can cause you to be more anxious, depressed, and your perception of your pain increases, and it's all very interconnected with sleep and all aspects of your health.
So is this where someone like a case manager, this is where you have to come into play, because for a traumatic brain injury, you want to take care of the triad.
Correct.
Taking care of one is not good enough. You want to make sure that each one of your patients or clients, if they're only taking care of the physical, they only have one peg of the stool.
Correct. Yeah, if you're just addressing the physical part, for example, if they're just taking pain medication, which may deal with the pain, but it may also further affect their cognitive functioning. It may make them more cognitively dull, or impair their cognition further, or may affect their emotions, or may make them more depressed. All these, so you really have to address all three aspects at the same time, or else you're really not addressing anything.
And you need to address the three aspects of the brain injury with their other functioning. What's their sleep hygiene like? When are they going to bed? When are they getting up? How are they eating? How are they dealing with pain in other parts of their body, not just their migraine headaches? And how does all of that interconnect and work together? Because I think all the people working with a client that's been through like an auto accident that has multiple situations should be looking at all aspects of all those things all the time. And that's when you realize, oops, this isn't mine. This is something I need to refer to Dr. Rodnick or to a psychiatrist or to the case manager. This is going on. It's not my expertise, but we need somebody to address this, because nobody's going to be energetic and be getting their life back together if they've not been sleeping for 5 years because they have sleep apnea.
And it goes both ways too. We'll see a lot of patients that may come to us, and let's say maybe the herniated disc they got in their neck or their back from the injury are the most important concern to them at the time, because that's what's aggravating them and hurting them most. So we're working on their spine to take pressure off the disc, off of the nervous system, but we see that they have clear cognitive problems. We need to make sure that we're able to send them to someone like you, to then send them to someone like you, or vice versa.
Right.
And it goes both ways, because we definitely see that when someone has such an injury that's going to cause traumatic brain damage, that they usually will also have a lot of other problems as well. Physically, we'll see a lot of problems with herniated discs, a lot of soft tissue damage, a lot of spinal abnormalities and injuries, compression fractures as well. And we'll start seeing them and working on these injuries too, but we want to make sure that we co-manage, because cognitively they need to be functioning properly.
Exactly. And just as the negative things seem to kind of snowball and negatively interact. When you start to address all the things concurrently, you'll see that they'll all affect each other positively. Like you're treating the pain and the mood disorders at the same time, so they're thinking more clearly or they're sleeping better. So the pain's better, so your mood's better, so you're sleeping better. It all interacts in a positive way then.
Absolutely. It's interesting. In chiropractic, we actually call it the 3 T's: thoughts, traumas, and toxins. Those are the people who need to see a chiropractor. You can get subluxated or misalignment from the thoughts. Just bad thoughts can put strain on the muscles, pulling the bones out of place. A trauma, obviously, you get into an accident, you want to do it. Toxins, putting these things into your body can cause these stresses. So you guys have the three aspects of TBI, and we have the same exact thing. So, I mean, we know exactly how you guys are dealing with this. We're dealing with the same thing. So that's why co-managing it with chiropractors and with you guys is huge, because we deal with these patients. Yeah. This is what we're dealing with every single day, is people that have these issues.
We like to think we're a good link with you guys because, you know, you're dealing with everything from here up. We're dealing with right below that area, and that's where we can see actually that the brain stem comes right from the brain, and this goes right through the very top bone in the spine called the atlas. We do a lot of work with the atlas, or the top bone, especially in these type of whiplash injuries where the head goes forward. It can really throw that particular bone out of place, and so where they already now have damage to their brain, what they are communicating isn't communicating properly through the brain stem and down the spinal cord, out the peripheral nerves. Right. And so we work a lot with that area.
And the thing that I found very often is the more physical injuries there are, the less likely it is that the traumatic brain injury gets recognized and diagnosed.
Right.
Because everybody's focusing on the pain and the broken leg and this injury and that injury, and they're not paying attention, or they chalk it up to they're acting this way because of their pain, when really they've had a brain injury. And the earlier the treatment in brain injury, the better the response.
With everything in life. I mean, no matter what, anything in life, the earlier you start taking care of a problem, the better the results. Right.
So. Absolutely.
And unfortunately, and I think the medical community has let some of their patients down too, because they're a little short-sighted, and sometimes if they can't put a cast on it, they kind of don't deal with it. And they don't see the behavioral or cognitive aspects, and they just look at, you know, if it's not bleeding or it's not broken, then we don't need to treat it. Yeah. And they don't see some of the subtle things that people may be complaining about or seeing in themselves.
And that's some of the difficulties that patients have, is people have trouble because others don't understand what a brain injury is. People look at them, say, you look normal, what are you saying? You got a brain injury, or why are you doing this, or why are you doing that? Because that makes no sense to them. But people with brain injuries look no different than people without brain injuries in many cases. And it's very difficult. People will just say, you know what, they're just not doing things right, and they're having trouble with memory, or they're acting in odd ways or different ways, and that's when you need to see a professional who can help you get help to resolve those things.
Now, would you guys say that a lot of the brain injuries that may be missed, let's say someone has a significant severe auto accident, well, they're at least going to get checked out. Well, what we may see is a lot of times the brain injuries that are missed are, kid was just skateboarding down the street by themselves, slipped, hit their head, passed out for a second, got up. Almost no one's going to notice the symptoms, almost no one's going to notice anything. So are there a lot of undiagnosed missed brain injuries that aren't from the big auto accident or the big work injury or things like that? Because at least with those, they're likely to at least get some sort of checkup, whether it's from primary care or from somebody. But there's so many injuries that I would say don't even get checked out by any medical professional.
I think absolutely that's true. Probably the recurring football or soccer injuries or hockey injuries, or the skateboarding, or just, you know, kids running around the house and bumping their heads. That happens, and it is additive and cumulative. So, you know, one or two or three minor injuries can make major problems down the road.
And sometimes when those are minor injuries that are cumulative, parents don't recognize that it's a brain injury. They think it's something else, or they're just being an acting out teenager, or different things are going on. I had a client come in who had been told a year and a half ago to stop playing football because he had had 6 concussions. And they were bringing him in wondering what was going on, and I said, has anybody evaluated whether you've ever had a brain injury? No. oh, 6 concussions, your medical doctor's told you not to play football anymore, and nobody's evaluated that. So I'm now going to evaluate him. But it's like they stopped the football playing, which was a good thing, and he stopped wrestling. But nobody looked to see what's the impact on him.
Would you say you have a few signs and symptoms that if a parent, let's say someone's watching the show, let's say their kid falls off the couch, falls at the park, is there any signs and symptoms that if a parent sees these, absolutely go and get them checked out?
Changes from who they were prior to that event. That's the most important thing, is the kid will be different in some way. They're not speaking as clearly, they're not remembering as clearly, just all different kinds of aspects. How are they different? And if you see differences, you need to get them evaluated. Could be emotional differences, it could be behavioral differences, could be they were a kid that always did well in school and now they're being lazy in school, and it just depends. And if you're not sure, get them evaluated.
Exactly.
And I would look at those 3 things: the physical, cognitive, behavioral. It could be that they're behaviorally they're not as motivated or not as driven, or they seem more depressed. Cognitively, they're not as sharp as they were, or even physically, they're complaining of headaches or bright lights bother them. It could be something as simple as that. That's a change that wasn't there before they hit their head.
And some of those symptoms are things that a lot of people think are common or normal. So we see people come in all the time and say, here's my 7-year-old kid, he gets headaches, a couple times a week, it's normal. It's not normal for a kid to get headaches 3-4 times a week. So that's the time when it's, at least they had brought them into us. But that's to make sure if people at home are watching, if children are getting headaches on a regular basis, get them checked out. Bring them to their primary care, bring them to a chiropractor, bring them to orthopedic, but get them checked out somewhere. And we see that a lot of times people will think, if there's nothing broken, they can get back in the game. That, broken bones are the worst thing. And, you can see that a bone will heal in about 2 months.
Yeah.
Our bone cells are constantly being replaced. We get about 6 new skeletons a year, where brain tissue, even soft tissue like discs, take a whole lot longer to heal, right, than you would say a bone.
Absolutely. And there is more research, and it's more optimistic in terms of brains healing with the appropriate treatment, but it is a much bigger process and takes a lot more rehabilitation.
Yeah, would it take about a year to 18 months for the brain to even start the healing process?
Yeah, in terms of if there are people who will what we call spontaneously recover from a brain injury, that it'll just take care of itself.
Yeah.
That's about a 1 year to 18-month process. If it were myself or one of my families, I wouldn't want to wait 18 months and figure out whether it spontaneously is going to happen.
18 months later.
I want to get the treatment and things like that, because that first 18 months is also, if it's not going to be spontaneous, where you can make the most progress and things like that. But the brain takes a lot longer to heal, because how I look at it or try to explain it to my patients is, imagine your neural pathways are really roads in a forest. Oops, I have a brain injury. A tree has fallen over that road. The brain can't go there anymore.
Yeah.
So the treatment is intended to help the brain find ways of rewiring around the fallen trees. And that takes time, because it's a very slow process.
I tell people who have had a head injury or brain injury, when they get so frustrated that they can't remember things and that information is still there, I said, you think of your brain as like a file cabinet, but the files are out of order. So all the information is still there, but when you go to look for it, it's not where it's supposed to be. You get to it eventually, but then you get anxious or nervous, and it's even harder to find it.
Right.
And like we said earlier, just go get checked out. There's no reason not to. There's no side effects of going and getting checked out. There's only benefits. If there's nothing wrong, great. If there is, also great, because now you know, and now you're there at seeing the right people to get this problem taken care of.
And if someone thinks they need to get checked out, go do it. But even before, there's a lot of pre-screening information, and you can go into the Brain Injury Association, the BIA. There's national and there's statewide BIAs, Brain Injury Association. You can find right on the website some pre-screening information. You take some surveys, and they do some pre-screening to see if someone possibly may have a brain injury, and then some great referrals out for neuropsychological evaluations, like Dr. Peyton here. You can find some links to that on our website at rodnickchiropractic.com, and your website as well.
If you go to thrivechiropractictroy.com, there's a few links there to actually take this pre-screening test.
To the BIA and get pre-screening for neurological problems.
Do you want to go? We have some segments of a few people under chiropractic care that actually were traumatic brain injury patients and the results that they got under care.
We'll roll those clips and we'll come back and talk about them.
Hi, my name's Lori. I've been seeing Dr. Rodnick for, 8 months or so. In 1986, I was in a car accident and I had a closed head injury. I was in a coma for 7 days, and it took me about 6 years to get back to the regular world. It's been the last maybe 5 years. I've had a lot of pain in my neck from arthritis that came to me early from the head injury. Since I've been seeing Dr. Rodnick, I can move my lip, I can move my head. I haven't been to, gardening is my favorite thing in the summer, and I haven't been to able to garden for like the last 3 years. This year, my garden is pretty. It's gonna be beautiful. I am digging, I am hoeing, I'm bending, I'm lifting. I'm not having pain. Thank you, Dr. Rodnick.
Well, I'd like to start by saying that I could tell you all the changes she has, but most of all was what the doctors, her accident happened in '04, October of '04, and doctors said that she would never move again, that there's no hope, there was no hope for nothing else to happen. And I couldn't take that, so I took her to a doctor in LA, and thank God I went there. In '07, I met someone there that said, there's Dr. Bob in Carmichael, and I thought, oh, what's he gonna do? So I did bring her over, and again, from '04 to '07, it was right what they said, nothing happened. She didn't move her legs, she didn't move her arms, she couldn't look, she was just, her eyes are going everywhere. And '07 we came in, and thank God for Dr. Bob. And so many years later, Delia's moving her legs on her own. She moves her arms, she eats. She came home with a feeding tube, now she eats. She watches us, watches TV. You can tell she is doing so good. And the latest one is that she can move her legs on command. And all this, it's been Dr. Bob, because he told me from the beginning it's going to be a long process, but I think it can happen, and it has happened. And one thing, if I can say, is please, parents, brothers and sisters, do not give up. Doctors are doctors and we need them, but when it comes to things like this, no, they don't know what they're talking about. So, again, I'd like to thank Dr. Bob for everything that he has done, and I believe that this is what has brought Odelia to where she is today.
So these are just two of thousands of testimonials that we see with people with major whiplash and traumatic brain injury through chiropractic care. And again, we can be a really good and great piece of the puzzle for the treatment of people with traumatic brain injury. And again, like we said, when someone has a TBI or major whiplash type injury, most importantly, it can affect the brain. But even here, when you think about our head is like a bowling ball on a stick. We have a big head, we have a small neck. So when the head goes forward, it causes so much soft tissue damage on some of the ligaments here, the anterior longitudinal ligament around the spine, the posterior longitudinal ligament, and these can stretch and shear. So now, instead of being strong like this, holding bones to bones, they can now shear like this. And so now they're weakened, they're more unstable, and so people can have severe neck pain. These can now, with that type of injury too, can cause pinching or herniation at the discs, which can now irritate on the nerves. We see a lot of people with these type of injuries have radiculopathy, which is symptoms down the arm, whether it's a numbness and tingling or a pain or a burning sensation, because we're irritating the nerves down the arms. And we see great results with that as well. But again, the problem is a lot of times people think of that stuff first because that's what they feel immediately and ignore the brain itself. And so that's why it's important for us to, as a chiropractor, someone may come to us just for pain and symptoms. It's important for us to refer out for neuropsychological evaluation for this type of thing.
Yeah, I think it's important for all the professionals working with people that come in for physical or other types of conditions to look at they're having these problems, or look for the signs. You know, the spouse or someone who's the caretaker saying, boy, they're just not who they were before. Or that's the most common phrase I hear. They're just not the same person. And they can't put their finger on what it is. They just don't think they're the same person. So all providers looking for those signs of, we need to get this person more help. We need to get them a case manager, or we need to get them evaluated for a brain injury. What do we need to do to help them get their life back to functioning?
And there's so many misconceptions from traumatic brain injuries, from whiplash injuries, of who should I go see, when should I see them. So basically, get a case manager, get evaluated, get checked out. I mean, someone would never even think in a million years, oh, I had a traumatic brain injury, better go to a chiropractor. People wouldn't think that. We have a case study right here that we'd like to talk about. This lady was 55 years old, and at the time of her accident, she was in 2 automobile accidents. After both accidents, she started noticing cognitive changes, physical changes, the things we were speaking about earlier. She had that numbness and tingling in her arms and legs that you were speaking about. And under chiropractic care, she was being seen twice a week for 7 months. And after that 7 months, after the first month, she started noticing the physical and the cognitive changes were starting to get better. And after 7 months of care, she realized that, like you said, she didn't feel the way she was before. Now she was starting to feel that way. She was starting to feel, okay, now I understand, I may be back to normal. Obviously, we want her to keep getting checked to make sure we keep her that way. But yeah, this case study shows, I mean, the chiropractic care can help. So if you had a misconception, hey, I don't need to see a chiropractor after this, I mean, it can help, and that's what the main goal is.
And I had a client very similar to that who had been under treatment by different providers and done different things. And she was wanting to go back to school, back to teaching. She loved teaching. But with all the pain medications and things she was on, there was no way she was going to be able to function efficiently and effectively. And we decided, try chiropractic care. And it helped reduce her pain. She could come off of her pain medications. Her mood got better. Her anxiety got less because of her pain. And she went back and she was able to be successful at returning to teaching.
And that's incredible.
That's
Yeah.
fantastic.
And I think that's critical. You want to look at alternatives to medications that may help the pain, but may cause impairment in functioning in other areas. So you want alternatives like chiropractic interventions that will help with the pain and help with some of the lifestyle issues while not interfering with other areas of functioning.
Right.
I always like to say, it never hurts to try the more natural first, drug second, surgery last. You want to always prevent the most invasive procedures if you can. Before there's no reason someone shouldn't try chiropractic care before they get a deep brain stimulator installed, or more invasive things, or a fusion in their neck, things like that. And a lot of times we'll hear from people in the public that, oh, I had a major whiplash, so I can't go under chiropractic care. And that's not the case. That's the reason for them to get checked and evaluated by a chiropractor. Obviously I wouldn't do the same thing on someone who could barely move or turn their neck and has to move like this than I would on someone who's a young, healthy athlete. And so we do evaluations, we take x-rays right in our office, and we have lots of different techniques we can do on even people that are non-ambulatory and have a tough time moving around. One thing we'll use a lot of times is an instrument where it's higher velocity and lower impact to make adjustments and work on vertebrae and soft tissue as well.
Yeah, if you use an instrument like this, people that their neck is so stiff from an accident they can't twist, we're not going to be doing any of those manual adjustments. We can just go in there, find the bone out of place, few clicks, and then the bone's back in place, and it helps with the physical aspect of these things. So, just being able to work together, I think, is the main goal, getting our patients better. If we sit back and think about the patient first, that's my biggest reason to getting into this profession. I've seen the results that you can get under chiropractic care, and not saying, hey, I'm going to take this is my patient. If I can co-manage with someone and the patient's going to get better, that's my biggest goal in life.
Yeah, teamwork is a word and a concept that may be overused, but in this case, it's critical. It's important that a treatment team is put together, that's assembled with people that work together and can form a plan and communicate and interact in a way that's for the patient's benefit.
Absolutely.
And keeping the whole person in mind. We can't isolate, oh, they're doing this at chiropractic and they're doing this with the neuropsychologist and this. We all have to look at the person as a whole and what they are struggling with and where they can make progress. And communications is vital. You know, I'm seeing this
phone.
because sometimes I might see something in a 45-minute session or an hour session with a person that you may not see, or you may see something that I don't see. So communications is absolutely vital to making this work.
It's nice that in an information age, things can be digital. It's, you know, obviously nothing beats
Absolutely.
personal connection and talking physician to physician too, but, you know, digital age makes it very easy to communicate records and information, like we were saying earlier.
Yeah, we don't need to pick up a phone and get on. We can just shoot you an email when you get the time. Boom, there you go. You have it right there, all the information right in front of you. It's not, yeah, he'll call you back. No, we can work together. Information age and technology these days makes patient care a whole lot easier.
Or tell your case manager, make sure everyone knows this.
Yeah, exactly.
Yeah, that helps too. And case managers do help in that way. You can make sure the information gets to everybody that it needs to get to. And they can be the central point of getting information back to myself. Mm-hmm. You know, there's 5 other doctors out there treating this person or 5 other professionals. I don't want to have to call and talk to all 5 of them.
Exactly.
The case manager can give me a summary or give me
it-
the information from all of them.
That's what his job is. He wants to do that. He wants to care for the patient. He wants to make sure everything's in order, in line, so that the patient's getting the best results and best care.
One of the last things I want to mention and ask to you guys too is, you know, you think of, let's say, an athlete, right? You can train your muscles and you can stay in good shape to help prevent certain type of injuries, but there's nothing really you can do to strengthen your brain to prevent a brain injury. Is that correct?
Well, you know, our body is totally connected, and eating healthy and doing all the things that you should be doing for yourself, you know, can help in any kind of injury, brain or otherwise. You know, research has also shown that, you know, with aging or with brain injury, omega-3 fish oils help because of the nylon sheath on the axon and things like that. So doing those kind of things can help, but just being healthy in general can help physically, emotionally, mentally, cognitively, and all of those things. But if you have pre-existing medical conditions, it can make you more susceptible to a brain injury.
Yeah.
You can't do things to prevent a concussion or brain injury, but you can do things to
Help the healing process.
help the healing process or make your brain healthier, which would be things that are cognitively stimulating, crossword puzzles, even video games, things that stimulate your brain.
Can help increase after the fact, but
Right.
as far as the injury goes,
No,
it's
you
still a
can't prevent
soft
it.
egg yolk. Doesn't
Right.
matter how
Right.
strong you are, or how tough you are.
Right.
The brain is
Absolutely.
still a very
Your
soft
head hits the
object.
concrete.
It's
Yeah.
a jello.
Yeah.
Yeah, it's just like a jello, exactly.
You still wear a helmet when you bike.
Right.
Absolutely.
And on a
Wear helmets.
motorcycle.
Yeah.
And motorcycles. Yeah.
So that's all the time we have today. I want to thank our special guest for joining us today. And that's all the time on Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce Township. We are here with our co-host, Dr. Ruben Rubenstein out of Troy, Michigan. And remember that God gave us the gift of life, and what we do with that life is our gift back to God. We'll see you next time on Ask the Chiropractor.